Ambassador, you want to share? Oh, it needs to find God, the way I sweat, it's out of this world. Ready? Hello, it's your girl Nikki Badmus, MC Honorable Laiwola for Hope Savers Foundation. I'm here with somebody very important. Like you saw on that flyer, the flyer says sickle cell and its psychological effect from a patient stroke carer's perspective. Yes, we know the doctors. They just do the blood test when the woman is pregnant, or they know the genotype, and it happens the woman is AS. They want to know what the husband's genotype is. Then they will test the child and they will know what the child's genotype is. Right now, we want someone that has experienced it or is experiencing it, or someone that is caring for someone that's got that problem. We want to hear from the person. We want to let you know how it feels, what it is like. So when you find yourself in that kind of situation, you have to take decisions that will not make you be selfish. However, some people get into it before they realize what is happening. I remember your girl Nikki Badmus, AKMC Honorable Laiwola. This is our platform where we speak Igbo, Yoruba, Hausa, Pidgin English. We deal with people from the grassroots. And Hope Savers Foundation is the one sponsoring this. Now, I'd like my guest to introduce herself. She's one of our volunteers. She's one of our directors. She's everywhere. Please, can you introduce yourself to us, please?
My name is Shakir Badmus. I'm one of the volunteers for Hope Savers Foundation. I'm also one of their directors.
Yes, she has just introduced herself. I brought her here today because she's a carer for someone that's very close to our hearts, that she's caring for. She can tell us what it's all about, what it is like, so that when you find yourself in that situation, you'll understand the pains. You will know, do I want to go through this, or I don't want to go through it? What is the next thing? First of all, can you explain to us what you think, not using the medical terms, what you think having sickle cell is?
Well, sickle cell is a disease. Actually, it's got to do with the blood. It's the blood, the formation of the blood, whereby the red blood cell, instead of it forming like a flat disc, it gives us the shape of a sickle, and that makes it very, very painful for the blood to flow properly and causes pains and all sorts to the body.
Yes.
So that is what sickle cell is.
Yes, when there is lack of oxygen, how the person speaks. On this platform, I would like to say welcome, welcome. Alaja Olaide, you're welcome. Favor King Atawale, you're welcome. Everybody on this platform, you are very, very welcome. Please, you can keep sharing. That is Mommy Biscuit. I love you, and you know that you're welcome, Mommy. You can keep sharing because somebody somewhere would have to listen to this so that they don't allow love to overtake them and make a wrong decision. Now, Madam Shakira, yes. How do you come about this? That did you know that your person then has got sickle cell?
No. It wasn't a planned relationship, obviously, and it just happened. And when I had the child, they did obviously this blood test, and at first when they said that it's got SC, I was like, oh, well, what are they saying? These people are chatting gibberish. I wasn't bothered. I didn't know what's the negative part of it, what it was all about. So I didn't know what sickle cell was all about anyway. I didn't know. So it wasn't a planned relationship. So we didn't check each other to say, oh, what is your genotype? What is my genotype? It just happened.
Okay. This can happen to anybody. Please, please, and please. Sometimes you find yourself in something you won't call a relationship. You just think, okay, we'll be friends. Then if one thing leads to the other thing and you are not family members, you are not related, and you just find yourself doing something with one another, or something leads to something, thinking you're going to start a relationship, and you go ahead and you do it and find out that, oh my God, my genotype, according to our genotype was AC and the guy's genotype was AS. So somehow she's a savior to the child. Let us put it like that. Now, all this while that you saw that, what is happening? Like I know that some parents in this country, in case you don't know, some parents, once they know their child has got sickle cell, they give it up for adoption. Believe me or not, I have seen it, we've experienced it, we almost make that mistake, but glory be to God, we didn't make the mistake. Now, when you realize there was a time, according to your story, you wanted to give up that child, right? Mm-hmm. Then when you saw your baby, you fell in love with your baby.
Definitely.
Ever since then, the love has been out of this world. Now, what triggers the crisis? If you have any question on this platform, please, you can ask the question. We are here to answer the question. Yeah, we are here to answer the question. Although I experienced it with her, but because she's the mother to the child, right? That's why I need to bring her here so that you can hear from her direct, right? If you have any question, please put it out there. We are going to respond to it. My response.
Sickle cell anemia, the SC, the C hemoglobin C disease. It's actually, that one is the more easier and less complicated compared to the SS. Although it's got the same prices, and what triggers is the child mustn't be too hot or too cold. Mm-hmm. Once they're too hot, it triggers crises. They start feeling pains on the muscles. They start with muscle pains. Anything could happen. When they're too cold, it's a problem. When they're too hot, it's a problem. If they just bang their leg on something, it's a problem. So it's pains is the major problem. Once they start experiencing pains and you can't manage it at home, then that's a big problem.
So how do you manage his pains?
When obviously to start.
Hold on, mommy. Oh yeah, Princess said the video is not straight. We decided to do it on a landscape because for videos like this you need a landscape, right? We don't want to put it straight. It should just be showing me, but we want it to be on a landscape so that we can put it out like this. If you don't mind, just bear with us. We just want to put it on this landscape. We are standing straight, but we will be too tight because the couch thing, and we don't have this big, massive camera to do it. We are so sorry. Just bear with us. Thank you.
What was the question?
No, the question is, how have you been managing this pain?
Well, actually, before the pain kicks in, it gives you a sign. You look into the eyeballs and the eyeball goes yellow. Once the eyeball goes yellow, then I tell my child, oh, looks like you're you're going into crisis, and he's like, Mom, I'm fine. Then I tell him, you know what, you need to take it steady on, you need to slow down on whatever you're doing. And once he slows down, it helps. But this is it. Once he starts the pains, it starts from his muscles. Once the muscle pain starts, and we try giving paracetamol, then if paracetamol does not work, we up it up to cocodamol. If that doesn't work, then we need the hospital where it gets the oral morphine, as in morphine through the vein. That's what
IV morphine.
IV morphine. That's what works finally.
So when he's going through this pain, how do you feel? How can you help? How do you help him when he's going through this pain?
Well, that's the emotional and sad bits. You can't help a sickle child when they're in crisis. You're just helpless. You can't do anything. It's so heartbreaking. You see your child in pain, like you see them like they're crying, they're in pains, but you can't do anything because you can't even. There's nothing you do that will help because you can't just do anything. All you just have to do is stay there and you cry your eyes out while they're crying, but because you don't want them to see you crying, you take your you try to hold it in and just keep praying to God for miracle to happen, for God to heal him, because some people are not lucky. Because in my own case, I count myself one of the luckiest one, because my son is being in serious crisis, severe crisis, whereby he's complaining of leg, and before you know it, his hand, and where he was just there crying, and Mom was like, Mom, help me, Mom, help me. I'm like, I don't know what to do. I can't help you. As a mom, I was in beats, I was in tears. That was just it, and I was praying to God to just work wonders. That was what I could do, but I couldn't do anything. It was just prayers and just looking at my son in pains, but I couldn't do anything.
You know how painful that is when you cannot help your child and your child is in pain. This is one thing that I've been telling mothers, I've been telling parents, that please help your children when it comes to this spouse thing. Do not let it get to that level where they will be so much in love and they won't be able to make decisions. I have been there. I made that decision. Men are not good with such decisions. I made that decision, and here I am today. Now she found herself in a kind of awkward position whereby she doesn't have a choice but to have that child, and falls in love with the child. That was the same child I celebrated on his 16th birthday. And this is a footballer. You can imagine, because he now understands, right?
Yeah, he understands his body, because when I went to see the consultant, I was moaning like, he's playing football. They said, well, allow him to do whatever he wants to do, what he enjoys doing. Now he knows his body. He manages his pace himself. He knows when he's going into crisis. He knows when to slow down. He knows when it's too hot, when it's too cold. So he knows his body. So that's just it. He knows how it goes now.
That is what I'm trying to say again. The education part of it. And like I said, you don't have to go to university to go and learn it. No. Now this child can manage his crisis himself, because he has gotten to this point where he doesn't want to be crying. He feels for the mom. But when he's in pain, he reels it in. When he's exhausted, you will see him and he will sleep like no man's business. Now, this took the mother, the doctor, the family, because I won't lie to you. If anything happens, when that guy is in crisis, our life stands still. Because I can help him. I'm called mama. The mother cannot help him. He calls mom. The father, the uncle, the everybody, nobody can help him. We just sit around him and tell him sorry and be praying. Right? So please, parents on this platform, please. I met a lady 2-3 days ago. Yes, in the party I anchored on Saturday. And I was just saying this thing. She was watching my program. She didn't know I was the one there, because I was now looking different and everything. She said, you know what? I need to go and know my genotype. This woman has just nailed it. Yes, this is the kind of program I want to watch. This is this and this is that. And at the end of the day, I turned around and said, do you know who is talking? Said, I don't, but she hardly comes online. I just wish I know how to tell her to come online, blah, 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 and give us educative shows. So that the one day she looked at me and said, oh my God, auntie. Oh. So I now gave her a true life experience. And to God be the glory, she told me she is going to check her genotype. She doesn't want to believe what her parent says. She's going to check it to know. I said, whatever your parent says about your genotype, if it doesn't change. But if you want to go and check it, go and check it. But make sure whosoever you're getting married to, that you'll be attached to tomorrow, is not. If you are AA, you can get married to anybody. If you're AS, you have to be extremely careful not to fall in love with someone that is an AS. Yes,
AC.
or AC. Divine intervention is there. I know a family that they are both AS. They have 4 children and all their children are AS. It is very rare. Please, it is very rare. This one has
something, please.
Go on.
Did somebody say divine intervention?
Yeah, that girl yesterday.
Yeah, there is divine intervention, but sometimes our God is not a magician. Let's take it that way. Once, if you don't know, you don't know. But if you know and you decide to, like, you want to test God, then seriously, you're really putting yourself and that unborn child in danger. Because why would you want to say God is divine intervention when you know you're a carrier or you're a sickler or you got sickle cell disease itself, and you want to go for someone that is a carrier or has got a sickle cell disease itself? No, that's mean. That's what I can say to such person. That is not asking for divine intervention. That is you being mean. Because I'm talking from experience. If I knew, if it was a planned thing, it's never going to happen. And after then, the person, my partner now, I made sure he's AA. I did that. I made that finding. I never went with somebody. As soon as I found out you're a carrier, I run off. No matter what. Because it's there. I can experience it. The child is there. He's living ill and hearty, but why would I want to go again to do such? It's fair enough. One mistake is one mistake. Not doing the second one, knowing fully, no, that's wrong.
That's been a selfish person.
Yes.
That's been a selfish mother. And let me tell you something from what she has said. Thank you very much for coming to share this beautiful part with us. Please, 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 I beg of you. I keep begging. I'm sure she's begging as well. Do not go for someone that you're of this. If you're AS, do not bother going for someone that has got AS or AC. It is not easy. You're being selfish. You're being mean. Please, even if your child is 18 and 19 or 21 and say, oh, mommy, I am in love with the person, do not force this child. Just educate them. Because I can tell you, I have come across professionals, medical professionals, they don't know what sickle cell is. We have to. How many times have you been?
The last time my son had crisis that I took him to the hospital, I had a proper fight with a nurse, because as in a senior nurse and a senior doctor, you don't know what sickle cell is. They were just saying, do this. I was like, no, you need to administer IV morphine now. And I was teaching them, telling them what to do. And they had to get the consultant in, because it was an holiday. They had to get it in straight, because I said, I want the consultant. When the consultant now came, I said, listen, next time the mother of the child tells you something, you listen, because she knows the child better. And did not apologize and said she didn't know about it. I had to explain to her what it's all about, what sickle cell is, how it's being managed, what causes it, the genotype, knowing each other's genotype.
Lack of oxygen once there is an injury, you lack oxygen there,
that's the
shape. When you lack oxygen, even when you don't have sickle cell and you are deprived of oxygen for a minute, you know the way you feel. Not to talk of a particular place does not. I remember one time he said his finger was paining him. It was a finger, you remember?
Yeah.
We started with the finger and we landed in the hospital. I stopped placement, the mom stopped whatever she was doing. We started going there. The mom was sleeping there. I'm here taking care of the other one. So it is not an experience you want to have. If you have the chance, you can avoid it. If you have the chance, you can run away from it. Please, please, please. I can tell you tentatively, this thing has got a psychological effect to it. Yes. Now, if this family, like my family, if they do not know how to manage this thing, by now my lovely nephew will be depressed.
Yeah.
But because we went in my college, I went to a college first before I went to the university. Notwithstanding, I came in with a master's into this country. And I used him as my dissertation in the college. So I can close my eyes and gist you about, like my sister can close her eyes and gist you about sickle cell. I can close my eyes and gist you about it, even talk about it medically. Are we understanding each other? Talk about it medically. I did that And it paid me because I want to understand more. That is why in Nigeria, in Africa, they will say someone is suffering from Obiku or Gbanje. Forget it. It is not Obiku or Gbanje. It's this sickle cell business. And when they go into depression, that's when the mental health problem comes in, the psychological effects. All they need is tender love and care. Whatever they are doing, I can tell you tentatively, if you see my son, you will not even know. Some people will be asking me, are you sure? I said, go and ask the mother.
Anyway, he's walked past. He was one that walked past.
He walked past here. Go on my page and look at the boy I celebrated some few days ago. That is a 16-year-old boy looking like I look at him like this. I have to stretch to look up. He's living healthy. Now, because we know what it's all about, let me tell you, one of the psychological effects of sickle cell, don't look at it like, what are these people saying? It can make you depressed, anxious. It can affect them academically. It affects their academic performance. That is one thing I want you to know. I have read it, I have done research on it, and I am experiencing it as it is. But to God be the glory. Touchwood, we've not had this crisis for a long time because we manage it. And the mom is watching the eyes. I am watching the eyes. The boy that is suffering it is watching the eyes.
And also, he's keeping on top of his medication as well.
Yeah.
So that is very important. He's keeping on top of it. And don't get it wrong. Even sometimes these doctors, they make mistake because they've got different medication for a patient that has got SC and a patient that has got SS.
I was going to come to that. What's the difference between SC and SS? Because you told me about the medication bit.
SC is more, it has more crisis and they're more sickly. They're always
SS.
sick. That's SS, I mean. But SC is on the pains are reduced and the crises are a bit reduced as long as you're keeping on top and you're able to manage it. For the SC, they use the hydro, whatever. I think I got it somewhere. They use the or something like that.
You can't pronounce it, you'll be doctor.
That medication is used for patient that got cancer. That's how strong it is because it's got to do with the blood. My son was prescribed that medication. That was due to the doctor's negligence. But luckily, I cancer it, and I told the doctor, I felt reluctant. I said, no, my son does not need that medication. And the reason why they give that medication is because they think they're always in crisis, and it's out maybe when they think they're bedwetting. I said, no, my son does not. He stopped that a long time ago, and he's not always in crisis. So I took my time, and once they start taking that medication, the problem is this: they have to do their blood test every 2 weeks because it thins the blood, which is not a good one anyway. So I felt reluctant. Then
we had a discussion about it, yes. And I told you no.
Then a day to when I was meant to start, then I got a call from the hospital. Another consultant rang me and said, Shakira. I said, hello. I said, it's a consultant from the MRI, from the children's. I hope you haven't started taking that medication. I said, no, I don't even want the medication for my child. She now said, please don't, because your son is not got sick. He's not got SS, he's got SC. That medication is actually for the SS patients. And she called me, she told me to come in, which they really apologized. They had to apologize because I said I could sue them, but I wouldn't do that because they've been helpful, so anybody could make that mistake. But I said, assuming I had used that medication, what happens to my child? Because this medication is a strong medication for patients that are sick, that have got SS, and patients that are always having crisis, and patients with cancer, that have got cancer, that have got leukemia. Also, that's got to do with cancer, but my son is not in that category, and he's not always in the hospital. Why are you telling me? Why did you even come up with that? I said, well, it was a mistake from another consultant, which he came and apologized. I said, well, it's all right. But for patients with SC, their medication is penicillin, which is twice a day, 5 mg, and folic acid, which is once a day, 5 mg. That's for patients with SC, not.
Now, with that you have said, that is why no matter the medication you take from the doctor, please make findings. The doctors are not always right. They are there to prescribe. They will tell you what they think. They will tell you what they've studied. Respect to the medical practitioners. But they can make mistake. It's just like a doctor that prescribed and gives it to the nurse. It now falls on the nurse to look at the patient. Okay, you want to give a patient with heart problem. You want to give them this bisoprolol, right? And this patient's heart rate is less than 50, I think. And you want to give a patient a medication that slows the heart. Even if it's the doctor that prescribed that medication, it's your duty to take it back to the doctor and say, no, I am not going to give this. Question it. Or you don't give it and give the reason why you are not giving it. So now in this case, we the parents becomes the nurse at that particular time. Question all the medication. Read about it. Ask questions. Because from there you educate yourself. That's a way of educating yourself. I didn't go to university to go and study it. Neither did she go to university to go and study it. We learned on it for the love we have for our child, for the love we have for him. We had to go all out to know what's really happening. And let me burst your bubble. In the advanced world, the white people are now getting it because of the interracial marriages going on. They are now getting it. Please, mothers, parents on this platform, keep sharing this. Please know your child's genotype. Advise, guide your child on who to go with. Explain to them. Don't let them fall in love. Then you now tell them, you know that person. They won't understand you. They will not understand you. Once again, I say thank you very, 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 very much. Because I know she's very busy. She's a nursing mother. Has a cute baby now. I had to drag her that, please, you are a volunteer and a director, please, oh, we have to do something on this. Which is very, very important because people are making that mistake. By the day they are making the mistake. Please, and please, and please, go and listen to the program I did before and listen to this one. You will see that we have a lot to do for our children. They are still our children. Even when they are married, they are still our children. We have to guide them. Let's guide them right. Let's make something good out of these children. Please, let us do it. Children with SS, SC, you don't wrap them around the cotton wool. You put them all out there depending on what they want to do. Yes. Encourage them. Am I communicating?
Yeah.
He has played for City. He has played for United. He has played for Everton. They have taken him everywhere. Am I communicating? They have taken him everywhere and he's enjoying himself. You will not say that's the end of the world. I can guarantee you that's not the end of the world.
They don't even like to be wrapped around the cotton wool.
Not my nephew. He doesn't like being wrapped around the cotton wool. For what? What cotton wool is that? Even when you see himself, you have to like ask, is it the person? Or you are thinking, Abisha mistake.
I've taken him to the hospital once where the doctor said, who is the sick patient? Is it
you mom or the child?
Or the child, because he was looking out there and I was that thing.
Yes, because it falls back to us. It falls back to the parents. When your child goes into crisis, you don't know what to do. You can't even hug the child. Even if you hug the child, it might be that place that you are hugging. You leave the child, it might be that place. Your hand needs to be there. See, I've slept with him in the hospital. I knew I didn't sleep. I was looking at him like I was looking at film. Crying within myself and praying. We were praying. Every time he goes into crisis, we are praying. And I give it to the mom. She is a strong woman. You will not say anything negative. Call it walk. She will counter you straight off. Counter you straight off. Please, parents, we have a lot to do. Please, we have a lot to do. A lot to do when it comes to our children. Know your children's genotype. Know who they are moving with. Understand your children. Whether they are in Africa or they are here, they are still your children. There are some children that lives in Nigeria or lives in any part of African African countries. The way their parents relate to them, you would think they are in a developed world. No, they are not there. It's the way the parents relate to them. They make sure they hide their children away from violent environments. Make them understand. Why we have some that are here, they can't be bothered. Woman sick. Let me out here to sue me.
But most parents that does that are parents that give up on your children, because once you see your child is got sickle cell, that's not the end of life. That's just the beginning of life, because they've just started the life. It depends on how you're able to show them the love the care, you understand? Because once you show them love, TLC, that's
tender,
and care, you understand?
Tender love and care.
Once you show them that, it's gonna help them grow. And don't get it wrong, children with sickle cell become parents as well. They can still have children.
Don't get it wrong, they do.
No, they can still have children. They can still get married.
They can get married, impregnate someone, and even have children.
Yes, definitely.
They can be daddies, they can be mommies. No, don't give up on them. But I've seen loads of parents have given up on their children. Kí ló ṣe o, tuti lọ sí hospital tí ẹ ti sú mi, ilé ayé tí ẹ ti sú mi. No, má jẹ́ kí ilé ayé sú ẹ. Don't kill your child before the child even thinks of giving up. Don't give up on your children no matter the circumstance. I say it to parents every time. Do not give up on your children. They are the heritage of God. For that child to still be alive, they are the heritage of God. For you to get pregnant and get to that level where the child is 1, 2, 3, 4, they are heritage of God. This is their life, you live it with them. Understand them. Don't have to scream, because when we speak on the phone and you think you're talking to somebody and the child is not there, you'll be shocked that the child will hear what you have said. And that thing will linger in the child's brain. And that will kill the child. Let me bust your bubble once more. Do you know that people with HIV, people with cancer, it is not the disease that kills them.
It's the thought.
It's the thought of it that kills them. My son knows now not to feel sorry for himself. He knows now not to feel sorry for himself. He knows now to use his medication. He knows now to do a lot of things for himself. He knows when he's exhausted. God is not a magician. As he's growing, be praying. He told that fadra, he told that fadra. When he's good, you need prayer. When he's not good, he needs prayer. Don't turn God to magician. He's not interested in your magic. Don't say tomorrow, Ọlọ́run ò gbàdúrà, ó ń gbàdúrà o. It's just that àwa la sìn bó ṣe yẹ ká sìn. He's using the medication, yet we are praying for him. Yet we use him as a point of contact. Am I communicating? We use him as a point of contact. When he performs in school and the thing is not thingy and is not good, we know that sometimes one of the psychological effects is less performance in school. But one good thing is this: we don't use that on him. We talk to him. Some of them will have behavioral problem. It's not them. That is the psychological effect. That is their own kind of coping mechanism. You see some children that's got sickle cell, they'll be misbehaving. Serious misbehaving. They don't want to misbehave, but something that is not right in their body is making them misbehave, and the parents are complicating it. Because the parents have already given up. They have not taken their time to know what's wrong with the child. Am I communicating? They have diagnosed my nephew with something, and we refuse to use the medication and said he's not having it. Instead, what do? It's talking. Yeah. We do our own local CBT to him, and now he knows.
He knows even like it.
It does. If you just tell him anything ADHD, he's going to have a problem with you, because he does not even see it possible. He doesn't see it possible. But some parents will feed on it, sit on it, and be using that medication for what? I don't know. If you're using the medication and you're not helping the child, you're just being selfish. Educate yourself on this. We are not talking from the moon. She's not talking from the moon. She's talking as a life experience. Our children are still our children. Please go know your genotype. Guide them when it comes to marriage. Guide them when it comes to relationship. Even before we came on, we were teasing my boy. And he was telling us certain things and I was laughing. Please, they are still our children.
And I always remind him when he was telling me about a friend, a girlfriend.
No, he said not girlfriend. He said mommy is a girl and a friend.
So I said,
not a girlfriend.
And I told him, I said, listen. And I said, listen.
Thank you.
I said, listen, love. have you told her about your genotype? Said, Mom, she's just my friend. If eventually we get to the next stage, I'll let her know. I said, that would be very important because I wouldn't want you to leave it late. I said, Mom, she's just still my friend. I said, all right, I rest my case.
It took me a long time to understand. I thought girlfriend is you have a friend that is a girlfriend, like you have a boy that is a boyfriend. No! To them, girlfriend is the next level of I have a friend that is a girl. It's not called girlfriend. It's a friend that is a girl. The next stage that they are going into relationship is she's a girlfriend. I was just laughing my head off. I said, this generation, I tire for now. They don't want to make mistake. They want to explain it to you the way it is. Any words of encouragement for any parents that is...
Well, for any parent that has got a child that has got sickle cell disease, all they can do is just keep praying for the child. Don't give up on the child, and just keep showing them love and encourage them that there is more to life. Even when the children are feeling down, you just stand there and help them. Keep encouraging them. You lift you up them, lift their spirits. Don't give up on them because they are the future of tomorrow, and there's something that.
Thank you very much. God bless you. I know you can't wait to run along because of the little baby. Now, on this platform, like I said, I welcome everybody. I thank everybody that is here. Please keep sharing. Somebody might just need it. Somebody might have just given up on their child or children that's got this sickle cell thingy. No, it is not their fault. All they need is TLC. I pray that every child that we have, any form of disablement that is in that child, God will enable them in their own little way. Please, 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 you can keep asking your question. You can later send me a message. I will respond to it. Then when next, I don't know if it's tomorrow or next, we still have another beautiful topic. It's still on this, our children, so that we'll understand better. And thank you very much to Mitope Matthews. That's one of us in Hope Savers Foundation. Folashade Adeleke, thank you. That's my Josh's mom, thank you very much. Oluwatoyin Oladapo, my sister, thank you. Fausat Amokwe, I'm okay. I'm sure that is twins, thank you very much. God's power Ashake, that's one of my sister. Mommy Biscuit, thank you very much, mommy, for sharing my program. My sweet Royal Majesty Princess Elizabeth Ononuga, Favor Atawale, that's my sweet darling brother. Thank you very much for everybody that's come onto this platform to share with us. Thank you for people that has just speaked and they are gone. Thank you so much, Yvonne, my childhood friend. I love you big time. Thank you. Until we come your way again, we remain your person from Hope Savers Foundation. They are the ones sponsoring this. We'll see you very soon. God bless you. A little bit of kindness can just give someone else hope. See you later. Bye.